Hi there. Welcome to the Distant Education Online Learning Center. Today's guest is my good friend and alternative medicine physician, Dr. Satara Vishnu. Dr. Vishnu will be introducing a new feature on our conference center called BlackBeltMedicine. He will be describing all the exciting methods of self-healing that is possible without those evasive treatments that we're all familiar with, that is often more dangerous than the condition these treatments are used to help. I've been a patient of Dr. Vishnu for over 3 years and have experienced the value of self-healing methods, while also engaging the services of medical doctors who make sure that my condition remains stable, or in my case actually improved dramatically because of the testing and guidance provided by Dr. Vishnu. At my last visit, after learning that his testing methods showed remarkable improvement in my overall condition, I inquired as to what methods of self-healing could be taught over this online conference program. I was pleased to hear that his POWR cord hand therapy for chronic pain and injury was his choice. Since I've been using this method for curing headaches and common bruising and simple injury occurring in dojo, I agreed, knowing, hey, if I could learn this method, just about anyone could. I'm very pleased now to turn over the podium to my good friend, Dr. Satara Vishnu.
Thank you, George. Hi, everybody. I first off want to thank you again, George, and say that I'm humbled and very excited about the possibilities that are available here, in that we are really stepping into something that's, as you look at the first slide here, that's completing the circle. Because since the beginning, the art of karate and all the different martial arts have walked hand in hand, almost 1900 years now, with traditional Oriental medicine. Historically, when people would train and they would get injured, they would use the theories and the practices practically of Oriental medicine to heal and also to come back in balance. And that's what we're doing here today, is we're completing the circle. We're bringing to modern times these ancient healing practices with modern technology. And that's really what we're going to be speaking about, and really giving you a heads up and a really practical education on how you can utilize this and implement it immediately into your life to provide balance and healing. So let's get on with it. And first off, what we're going to do is we're going to talk about the benefits of ancient wisdom combined with modern technology, providing a lifetime of balance and well-being. And what does that really mean? Well, it really means that we're going to get involved into what I feel are the real basics of this system of black belt medicine. First, we're going to talk about POWR cord technology, and then we'll speak about the SOOJI healing system, and then mix those two ingredients with treating acute pain through the hand, and then working to resolve chronic pain and how that differentiates from acute pain, utilizing POWR cord and the SOOJI applications. And we'll bring in another aspect of that, and that will be about balancing the yin-yang pulse, because again, in Oriental medicine, it's all about yin and yang, or female, male, hot, cold, hard, soft. So we'll get an understanding of how this all works for all of us, and how it can be applied very easily, very effectively, and very inexpensively. The whole point of this whole experience, and the multiple experiences we'll have as we move through this whole system of black belt medicine, will be to provide us with empowered self-care. And that's the key, folks. It's about the whole enchilada, as they would say. It's really coming to the nature of giving ourselves the power to treat ourselves, to stay in balance, and do it in a safe, non-toxic way. And so from that, we're going to immediately move into POWR cord technology. What is POWR cord technology, and how does it work? How do I apply the use of the POWR cord? And where can the POWR cord be utilized, and for what kind of health issues? Well, first and foremost, what is the POWR cord and how does it work? It happens to be around my my neck right now. It's a very, very simple technology. It is two probes with a wire in between. The beauty of it is built to provide an opportunity for us to move energy in one direction. And so that provides us with the opportunity to take the power of the acupuncture points and utilize them in a directional manner. So if something is overly strong, we can draw off the energy. If it's weak, we can provide more energy to an area that needs it. And this is all about changing the energy, moving the energy, or some people call it chi, and also the blood, because we know that pain really relates to a stagnation of blood and chi, or blood and energy. And so we're taking that bioelectric energy, utilizing the power cords to help move that energy and as a result, in blood, and as a result resolve acute pain. How do I apply the use of the power cord? Basically, it's on the skin. It's 2 points. You can hold them like chopsticks, and all you need to do is place them on specific points, which on the next slide we'll talk about, which is the SOOJI healing system. So it's not limited to the hand. So what we can do is utilize them on any system, and that's the beauty of what we're going to be speaking of on the next slide, is how we can utilize the power cord in not only pain, but also in multiple issues of health, whether they're acute issues, whether they're chronic issues, and how pain many times can be just a reflection of a symptom that is reflecting in pain or some other form of discomfort as a result of energy imbalance and, again, stuck blood. So as we move on, what we're going to do is at this point talk about the SOOJI healing system. A short history lesson on Koryo Sooji Chim. What is Koryo Sooji Chim? Well, it is basically the newest form of traditional Oriental medicine. It was developed in 1971 by a 7th generation acupuncturist and doctor of Oriental medicine, Dr. Tae-Woo Yu, whom I studied directly with from 1986 to 1991. And basically, he found this system because he had a headache for 30 days that he could not resolve. And he tried everything: Western medicine, drugs, acupuncture, herbal formulations. Nothing seemed to work. And one day he got inspired to take the tip of a pen and place it on his middle finger, and the tip of his middle finger. And within 30 seconds, 85% of his headache was gone. Well, that was the inspiring moment for him to develop this new system of medicine, of Oriental medicine, we call it the SOOJI healing system. And why is SOOJI hand therapy the preeminent therapy for ridding pain from the body? Well, basically because our brain is hardwired to our hand. 40% of our brain, of our computer processing units, or CPUs of our brain, are dedicated to remembering our hand motions based upon our opposing thumb. And this little opposing thumb here, in terms of remembering our hand motions, is stored in our brain. So that relationship between the brain and the hand provides us with a direct opportunity to utilize the power of the hand to immediately affect the whole body through the brain. And because the body copies itself completely on the hand, front of the body, front of the hand, back of the body, back of the hand. And we'll be moving into that a bit more as we move into this, the sessions that relate to understanding SOOJI cartography. And so what determines the flexibility and depth of SOOJI as a consistent and effective form of healing therapy? Well, the beauty of it is not only do we have corresponding points on the hand, as I just mentioned, but every major organ meridian on the full body acupuncture points reflect the hand, in the hand. So every finger has 6 meridians on it, and they reflect every organ in the body. So we can manipulate and move the energy and stay in balance on an overall level by many different kinds of therapies. The power cord technology is the fastest, simplest, very effective way. We can use magnets, we can use press pellets, we can use rings, and we can use these on the hand, and in later sessions and further courses as we evolve and move into this beautiful system of black belt medicine, we'll be talking about how you can utilize the power cords not only on the hand but perhaps on the ear or on the scalp or on some full body points, because they're all very powerful. We just know, and it's been my experience in almost 30 years of practicing in this field of Oriental medicine, that the fastest way to get rid of pain in the body is to access it through the hand. So that's the beauty of what we've got ahead of us here. Now, in terms of treating acute pain through the hand, the important thing is we're here to find, first and foremost, the corresponding point. So if we need to access the area of the ankle, we go to the last joint on the middle finger, and we'll find that we can take the barrel of our power cord and just roll the appropriate area or corresponding point of the ankle that's giving us a problem, whether it's the inside of the ankle, the top of the ankle, or the outside of the ankle, by rolling it and then pinching the area and rubbing it. And you'll find that the reflection of the pain we have in our ankle will show up in a sore spot, the corresponding point on the hand. And that's the first and foremost thing we'll learn, is how you find the corresponding point. Secondly, we'll provide opportunity and very practical information for us to apply the power cords on the corresponding point of pain. Again, here, and then we'll be talking about surrounding the dragon, the two wonderful, very, very effective, very simple techniques for you to disperse that energy and disperse the blood and also resolve that pain. And again, those two particular therapies are called Surround the Dragon and Through. Now, our next two slides are really a couple of very practical slides that will deal with some of the things that we're going to be talking about in the first session, or the first course. It'll probably be the second or third session that we're going to be getting involved specifically in specific dealings with acute pain. First and foremost, very common thing that we deal with is low back pain. And so this is a very, very easy, very effective, simple treatment for low back pain, and it only takes 4 points. We look at the back of the right hand, and what we're seeing is the corresponding point in the lumbar area. The black circle and the red circle relate to the 2 points that you place your power cord. And then also on the ring finger on the same right hand, showing the back of that hand, we're also looking at an organ meridian prescription that will help sedate an organ that is related to chronic and acute low back pain. So very, very simple, a 30-second treatment for each pair for low back pain. And the next slide that's coming up will be another treatment again for a very common effect, martial arts pain. We get a lot of it, and that is left shoulder pain. It's different on the right side, but these two areas are very simple and very easy to treat. So we find on the left hand, in the front of the hand, the right shoulder corresponding point, or I should say the left shoulder corresponding point, and we press that. You'll find tenderness there, and once we find the tenderness, we'll apply the pen. Same thing with the right hand. We'll help sedate the organ meridian that goes through that area and help to resolve it. And these are, again, very effective, very fast, and very easy to learn. So as we move on to go over the basic actions of your Black Belt Medicine course number 1 subscription, first, we look at the SOOJI hand chart. We'll be dealing with that chart. We'll be learning the corresponding points throughout the whole body, the front of the hand and the back of the hand. Secondly, we will have a really concise educational experience utilizing the power cord set and how we can apply that to the SOOJI micro system of the hand, and we will also incorporate pulse balancing. Again, where we're going to be dealing with and educating and bringing to bear the fact that we have these two pulses. One is the carotid pulse, and the other is the radial pulse. And so these two pulses, as we move on, will be learning how you can balance what they reflect, which is the fire and the water of the body. So we want to balance these two aspects. It's basically yin and yang. We want balance between fire and water, yin and yang. When we have balance, life is good. And so this is what we're going to be learning to take us to the next step, which will help us deal with some of the more chronic issues of pain and imbalance in the body. And first and foremost, you make sure that your yin-yang energy is in balance, and this will set the stage for everything else to come back in balance. In addition to the SOOJI hand chart and the POWR cord set, also there will be the interactive Black Belt Medicine training manual, which will provide you with an audio and PDF CD, which will also include places for you to index your training sheets, your session sheets, so you'll be able to provide them based on the area of the body that you're going to be dealing with, and so it's something that you'll be able to reference. And also this is will continue to build. So you'll have a manual that will continue to get larger and will become more specific and much more powerful the longer you get involved and take the time to learn this system. No different than learning martial arts. We always start from the basics and we move forward. So this is the learning the basics. This is what we're here for, is to learn the basics of black belt medicine, that we can move on and get much more sophisticated with this in a very simple way. In addition to that, I'm also providing personal sessions and e-visits. And what we're going to do at this moment is just segue a bit over to talk a bit more about personal sessions and e-visits, and because of the importance of those in relationship to this whole system. And there are times when the nature of a question or condition needs privacy, or an individual issue is more complicated and more time is needed to unravel the energetic cause. As a result, I'm offering one-on-one consultations via the internet in 15-minute increments for $25. I can be reached via email at 1acudoc@gmail.com or via phone at 352-217-2489. And this isn't something that everyone will need to pick up on, but I'm sure there are people out there that will have specific issues that need to get taken care of, that may need some more time. We also will incorporate a blog, and we will have questions and answers during our sessions. So if those kinds of issues can be dealt with during the sessions, we will definitely go there. If we can't, then you can offer yourself up some specific time with me so that we can go over your specific issues, and if we can, we'll post some of these as far as testimonials or opportunities for people to just see overall, without anybody's name, how this can be related to the healing process, and it can be applied overall to everyone. But in addition to that, what I wanted to do is just bring a little bit more into the process about those people that need more help, more specific kinds of help, and the kinds of technology I've been using for 27 years that can aid in helping you resolve some of the more degenerative and chronic issues. And this is really, this slide relates to a synopsis of personal treatment possibilities and utilizing the expanded services that I offer, which is called electrodermal screening and or meridian stress assessment. And what we're doing is we are utilizing a computer-based diagnostic system to measure the acupuncture points on the hands and the feet. And there's 64 points, and you'll see 3 slides here. On the left, the top slide, there's a graph. That graph relates to the points on the hand and the feet, hands and feet, that will measure the bioelectric energy of every organ in the body: the blood, the lymph, and the nerves. And in this particular first photo, we're finding that the patient's initial scan reveals multiple viral signatures, which you can see on the list on the right side of that first picture. And these viral signatures are causing a systemic form of degeneration. This was a scan done because this individual had real chronic issues. They were unresolved and was looking for a deeper, more a full way of looking at the body, especially bioelectrically, because the challenge comes from when we look at the body biochemically, we're limited. And that's unfortunate with the system of medicine that we have, but it's very great. It's an excellent system at diagnosing issues. Unfortunately, many times on chronic issues, it falls short because we're looking at the body just on a chemical nature. It is the energy that moves the chemicals, and that's the beauty of electrodermal screening, meridian stress assessment, is the fact that we can measure the bioelectric energy. So the follow-up scan on your second photo down there reveals that one viral pathogen remains. We can see that on the right side of that photo. The left side, you can see the graph is now normalizing. Normal means on a scale of 1 to 150. So related to the first slide, the second slide is much more even. It seems to be much more stable, and the patient's starting to feel better. The latest scan, as you can see on the bottom, reveals a normalization of the meridian control measurement points. These are the particular spots on the hands and feet that pretty much give an overall value of the meridian that the points relate to as far as the organs. And so everything's back in balance, and checking that after we did the scan in order to find out if there were any pathogenic factors, we found none. So basically the person over a short period of time really evolved into much greater health because of the fact that we resolved these viral signatures with natural medicines, with homeopathic medicines, Chinese herbs, nutrition, whatever works for that patient. And so it becomes an individual issue. And so each and every one that has a scan, it becomes their particular scan, and it is dealt with specifically for them. That's the beauty of holistic medicine and dealing with energy medicine. It's really specific to the individual. So as we move on, we're basically from this moment working on a summary. Here we are. We're at the point where we can fine-tune this, and this is the beginning of what our first course will involve, a 4-session course providing you with information on POWR technology, SOOJI hand cartography, learning how to treat acute pain, utilizing the hand therapy and the POWR core technology, and then also working with chronic pain treatments. We're specifically in the first 4 sessions, we're going to be dedicating that time to deal with very common issues such as back pain, headache, knee and shoulder pain, and the differentiation between each one. The back pain may be just down the middle of the back, it may be more right-sided, it may be more left-sided. So these treatments and the sessions we teach will involve each aspect of that. Is the headache on top of the head? Is it in the front? Is it on the sides? Is it in the back? And there will be information that will change and will be very specific for those kinds of differentiating headaches. No different than the knee. Is it inside the knee? Is it below the kneecap? Is it on the outside of the knee? Is it on the back of the knee? As well as the shoulder. So each of these 4 major areas that we're going to begin with in teaching black belt medicine will specifically get involved with all aspects of this kind of pain. In addition to that, again, we'll have the Black Belt Medicine Interactive Training Manual. You'll get a laminated hand chart, session handouts, and a 4-session audio and PDF CD. This whole package has a special introductory sale price of $199. Normally it will be $249, and you'll get 100% money back guarantee after the first session if you're not completely satisfied, and no questions asked. All you need to do is return all your handouts and the information we send you, and we'll be happy to provide you with that. I look forward to your involvement and a great journey here that we have an opportunity to really step into to complete the circle. And I hope you'll take advantage of it, and I look forward to hearing from you soon. Thank you, George.
Hi again. This is George Mattson signing off. But before leaving, I would like to thank Dr. Vishnu for appearing on the Distant Learning Center and to all of you who are viewing this film clip. Dr. Vishnu asked me to remind everyone who would like to take his first course to be sure and copy the registration URL that's shown in the middle frame and paste it into your browser. Once you register, you will be informed when the course begins online. You will have the option to attend the live session or to wait until after each session is recorded and the study material will be mailed to you on a DVD. By the way, in case you missed my message in an earlier interview, the patient whose charts were displayed during this session were mine, and those who know me know I'm not easily impressed. This program works. Hope to see you at Dr. Vishnu's next online session.